Ni hao, China. I'm Alison Shutt, the International Development Director who works at the Royal Free Hospital in London. So the Royal Free Hospital is a very specialised hospital. It's a tertiary care hospital. So for example, when the Ebola outbreak happened a couple of years ago, we were the only hospital within the UK who was able to care for patients who were suffering from Ebola. The Royal Free Hospital is part of University College London Partners, and many of you may have already heard about University College London, which is one of the top 5 universities in the world. The international department at the Royal Free Hospital has 4 main areas. The first area is education and training, and that's looking at collaborations between different countries and the Royal Free. The second area is looking at research developments. The third area is looking at hospital management and consultancy. And the fourth area, because we are a very specialised hospital, is looking at patients who have got very complex disease, who may want to have a second opinion and be referred to the hospital for their treatment and a second opinion. There are many opportunities for staff to actually look at exchange programmes from China with the departments here at the Royal Free Hospital, so that we have the exchange of programmes, the exchange of opportunities, and the exchange of how people are undertaking different services, so that we both learn from one another. We have at the hospital staff who take care of people who actually come here for their training, so that it's a very participatory approach and that their objectives are met. So we have been working with Sinolink now for the last 5 years, looking at exchange programmes from different areas within China to the Royal Free Hospital. And the process starts with Sinolink providing us with the curriculum vitae of those students who actually want to come here and undertake a 12-week programme. The length of the programme can be adjusted to the needs of the doctor or any of the students who are actually coming here. We start with an introductory session, which is where we introduce the hospital and the different departments. And then we link the member of staff who is responsible for that student so that they always have a mentor throughout the programme. We also undertake a range of lectures during the programme, and these topics include subjects which are pertinent to the National Health Service. They may be about clinical governance, about risk management, about leadership programmes, and the staff have exposure not only to these programmes but also to programmes which are also being undertaken for other members of the hospital team. The programmes provide a range of different subjects so that the students have access to what is key subject areas of development in the National Health Service. It's really important that the students feel that the programme meets their learning objectives and that they find the programme is enjoyable. And therefore we monitor the students very carefully throughout the programme, and this is a supportive mechanism which is in place. At the end of the programme, we then have a formal evaluation where the students are asked to participate again in that evaluation programme. And on the final day, we have a presentation. When the doctors and nurses come here, it's very important that this is going to be beneficial for also when they return to their individual positions back in the respective countries. If we look specifically at one of those exchanges, this was linked to the neuroendocrine tumour unit. It has got European Awards of Excellence. And the member of staff who came from Zhejiang province worked with the consultants here and then was able to actually go back and look at setting up the unit within China and then to continue to maintain the relationships with the consultants so that there was a unique exchange of ideas and development which has been able to continue after the programme had taken place. The Royal Free and Sinolink work very closely together to make sure that the respective students are happy with their placements.